as in frogs, as blood which has been oxygenated by reaching the lungs passes from the ventricle to the conus arteriosus. It then passes into one of the two aortic arches, which then fuse to form the dorsal aorta, which will then run the length of the back to reach the iliac arteries to the femoral arteries. On the way back, however, there are two alternate routes. The deoxygenated blood from the lower limb can pass through posterior cardinal veins and return to the heart. Or this blood may pass into renal portal veins and pass through the kidneys, and then into renal veins, and then into the inferior vena cava or post cava. This can then enter the liver and form a large, thin-walled area known as the hepatic sinus. A sinus is a wide vein with a thin wall before emptying into the sinus venosus.